So I just show you that there was some very promising data for the treatment of acute graft-versus-host disease, but we believe that in fact the story of the microbiota therapy in the field of hematological malignancies, and in particular in patients that are going to receive cellular therapy, will not end here. And in fact, I have been invited to discuss this topic during the ASH in San Diego this year, and we have more and more data now that come out. So I just show you, it seems to be effective to treat acute graft-versus-host disease, not only for the GI involvement, but also we have some response in the skin, on the liver. But maybe we should move this a bit earlier, or not as a curative treatment, but as some preventive treatment. So we have some studies that were published this year, where we try to evaluate FMT as a tool to reduce the rate of infection after allogeneic stem cell transplantation. Unfortunately, it was a negative result, but there was also a very broad endpoint on the take into account not only bacterial but also viral and fungal infection that might explain why it was not a successful clinical trial. Nevertheless, we have some more studies that are ongoing. We have some reports that show that we can use FMT to eradicate multi-drug resistant bacteria. We have also some studies that show that we give some feces after stem cell transplantations. It allows to restore the microbiome diversity, and in fact there is another clinical trial that is ongoing in Europe that plans to include more than 300 patients that will evaluate the use of pool microbiota therapy using some pills, March 33, to the patients or placebo, to restore the microbiome diversity and to improve patient overall survivals. This is for patients with stem cell transplantation. In the field of cellular therapy, we have also the hot topic of the CAR T cells. We know that we have more and more data now that show that the microbiome seems to impact the response to the CAR T cells, in particular for anti-CD19 CAR T cells for lymphoma or acute lymphoblastic leukemia. And it seems that it's not just a correlation, that we have some mechanistic effect, and we have an impact of the microbiome, of the fitness of the CAR T cells, and of the immune bystander. And in fact, there is an ongoing clinical trial in the MD Anderson Cancer Centers that try to evaluate the use of FMT to improve the response rate of the CAR T cells. So really thinks that it will change the field of hematology. And now in the next year, when you are going to use cellular therapy, immunotherapy, maybe you will need also to do some gut microbiota manipulation using a microbiota therapy product, FMT, or maybe some new drugs or new strategy based on the food taken by the patients on prebiotics. But only the future will tell us what is the best treatment and what is the best microbiota therapy for all patients, and how it will improve the outcome of our patients.